Hi, my name is Ryan McGillivray, and my population health assignment is on heart failure. So, to introduce the subject just a little bit, heart failure is a condition in which symptoms result from a structural or functional cardiac disorder that affects the heart's ability to fill or pump with blood. Heart failure is a global pandemic. Um, it affects around 26 million people worldwide. It has several causes, which include diseases of the heart muscle, heart valves, vessels, or by metabolic disorders. Heart failure is typically categorized into two types: systolic heart failure and diastolic heart failure, and this is based on the functional status of the left ventricle, or the LV. Systolic heart failure refers to a reduced ability for the left ventricle to pump blood out of the heart, and diastolic heart failure refers to a reduced capacity for the left ventricle to fill with blood, but the left ventricle has a normal ability to pump blood out of the heart. The heart's ability to pump blood is measured by the left ventricular ejection fraction, or the LVEF. A normal LVEF is about 60 to 65%. Systolic heart failure is classified as an LVEF of 40% or less, and diastolic heart failure has an LVEF of 50% or greater. Systolic heart failure is also referred to as heart failure with a reduced ejection fraction, or HFrEF, and diastolic heart failure is often referred to as heart failure with a preserved ejection fraction, or HFpEF. Attributing a single cause to heart failure is a challenge because in most cases it is multifactorial, or it can be caused by a separate chronic condition that begins to impair the function of the heart. Most patients with heart failure have chronic conditions, and the number of heart failure patients with three or more chronic conditions increased from 68% in 2002 to 87% in 2014. The most common conditions that predispose someone to developing heart failure: coronary artery disease, hypertension, diabetes, obesity, and smoking. The prevalence of heart failure and LV dysfunction increases with age. The Framingham Heart Study found a prevalence of heart failure in men to be 8 per 1,000 at age 50 to 59. That rate increases to 66 per 1,000 at ages 80 to 89. And there are similar values for women. The prevalence in heart failure for African American populations is about 25% higher than in white populations. At age 40, the lifetime risk of developing heart failure for both men and women was 1 in 5. And the history of myocardial infarction or a heart attack will increase your risk for heart failure. At age 40, the lifetime risk of heart failure occurring without the history of an MI was about 1 in 9 for men and 1 in 6 for women. Women are less likely to have heart failure, but women are more likely to have HFpEF than men are. Also notable, diabetic men have a twofold increased risk for heart failure, whereas diabetic women have a fivefold increase for heart failure. A 2019 meta-analysis found that people of low socioeconomic status are at 62% increased risk for heart failure. Some of the major factors that affect those of low socioeconomic status are medication non-adherence, lack of physical activity, poor diet, smoking, lack of access to healthcare, and stress induce biomarkers that are associated with inflammation. These are all factors that we believe lead to heart failure. Clinical manifestations of heart failure include exercise intolerance, unintentional weight loss, volume overload, ventricular arrhythmias, as well as hypotension, with hypotension being a late sign or a sign of acute decompensated heart failure. As heart failure progresses, patients will develop symptoms such as dyspnea, lightheadedness, or fatigue at rest or with minimal exertion. The severity of heart failure is classified according to the New York Heart Association. Acute decompensated heart failure is a severe exacerbation in heart failure that results in fluid accumulation in the lungs. The treatment of acute decompensated heart failure begins with quickly assessing and stabilizing the patient. Begin with obtaining vital signs, measuring oxygen status, administering oxygen if needed, initiate cardiac monitoring, obtain an ECG, get labs, administer diuretics and vasodilators promptly, monitor fluid intake and urine output, and consider inotropes for those with HFrEF. Also in consideration for severe acute decompensated heart failure would be things like a balloon pump or mechanical circulatory support such as an LVAD. This table is a representation of the NYHA functional class assessment. It begins with class 1, so these are patients who have cardiac disease but really don't have any physical limitations. And it goes all the way to stage or class 4, which are patients with cardiac disease who have severe physical activity limitations or even an inability to do anything or symptoms at rest. For patients with acute decompensated heart failure, the best predictor of recovery is the adequacy of diuresis. Adequate diuresis will decongest the lungs and reduce peripheral edema. Removing excess fluid helps to alleviate the pressure in the heart and allow it to pump effectively. A meta-analysis comprising over 1.5 million all-type heart failure patients estimated that the 1, 2, 5, and 10-year survival to be 87, 73, 57, and 35% respectively. A study with over 40,000 hospitalized heart failure patients found a very high 5-year mortality rate of 75%, regardless of LVEF. However, the heart failure survival rate has improved substantially over the years with a 20% increase rate at 1 and 5-year follow-ups. National and global policies that are impacting heart failure. Locally, in the city that I live in, and others have done this as well, they've implemented a sugary tax beverage and a tobacco tax aimed at reducing obesity, diabetes, and lung disease, all of which can lead to heart failure. In the US in the 1980s, the government attempted to remove trans fats from the food supply, again, in an effort to combat obesity and diabetes. The World Health Organization focuses their work globally to prevent and treat heart failure in vulnerable populations. The WHO focuses on low and middle income countries with the goal of addressing their social, economic, behavioral, and political determinants with an emphasis on modifiable risk factors such as tobacco use, unhealthy diet, physical inactivity, and alcohol abuse. The WHO also calls for banning smoking in public places, enforcing bans on tobacco advertising, promotion, and sponsorship, raising taxes on tobacco, restricting access to alcohol, bans on alcohol advertising, raising taxes on alcohol, reducing salt intake and salt content in food, and replacing trans fat in food with polyunsaturated fat. As we look to improve the heart failure prevention strategies, I believe we should focus on heart failure as a chronic condition that's often caused by a multitude of factors. So really prevention involves treating the underlying conditions such as diabetes, obesity, lung disease, renal disease, etc. Prevention of heart failure should be aimed at reducing the prevalence of underlying conditions and targeting the most vulnerable populations. Telehealth should be leveraged to increase healthcare access to those who were underserved previously. And in clinical settings, utilizing a social determinants health screening tool and a best practice alert could be useful for identifying at-risk patients.